There is a new danger looming as this country struggles to get the coronavirus under control. America's 7-day average has now hit nearly 130,000 new COVID cases. And over the last week, we averaged more than 100,000 people in the hospital. Nearly all of those people unvaccinated. Now, health experts are warning about a potential kind of double pandemic, a twindemic during flu season this fall as kids go back to school, especially in areas without mask mandates. CBS News medical contributor Dr. David Agus joins us now with more on this. Dr. Agus, good morning to you. Simple question, how should we prepare for this so-called twindemic?
Yeah, Tony, we hope it doesn't happen, but in the average year, 30 to 60,000 deaths from the influenza or the flu, 300 to 600,000 hospitalizations, and 10 to 15 million doctor's visits. So you couple that with COVID-19 and it can really strain the system. And then there's the fact we don't know what happens when you get both. Is it a double whammy and getting people more sick? So we certainly are afraid. Last year, pretty wimpy flu season, mainly because of the precautions we took to COVID-19, which also prevent the flu. This year, as precautions are going down, we're getting worried.
Is it safe to get a flu shot and a COVID shot in the same time period?
Yeah. So, well, I guess I should say the real answer is we don't necessarily know. And so the studies are ongoing now, giving a flu shot together with a COVID-19 vaccine, and they probably are safe. That being said, I would suggest if you're going to get them to probably separate them from a week or two if you can. If logistically it's too hard, it's probably okay. What you're worried about is the side effects of both of them creating a little bit more, the combination, and we just don't know the answer there. So I'd rather people separate if they could.
Yeah,
you scared me a little bit, David, when Tony said, is it safe to get them both? And you went, yeah.
And then, we don't know.
But then you also said we don't know, which I think is something that we should all take into account. When should we get the flu shot?
I have to realize that I'm speaking to Gayle King at the moment about a shot in the arm. And I have to be a little bit cautious here.
I was very resistant to the flu shot, but I got it. And you don't have to tell me twice about the COVID. You don't have to tell me twice about that COVID vaccine. I can't wait to get a booster.
We all need the flu shot this year, and it should be probably toward the end of September. The flu shot lasts about 6 months of immunity, and flu season is normally kind of October to potentially May. So if we can delay it and get it the end of September, beginning of October, I think that's the optimal timing, even though they're available now.
Dr. Agus, are people talking about a combo flu COVID shot?
Yeah, it's in development and, probably be around for next season if it's needed, a flu shot and the COVID, and we'll see if it's safe, because obviously one injection instead of two is a lot easier in everybody. We do it in children. We combine vaccines together and they work together. We're waiting to see what the data are with these two vaccines.
The CDC I was going to ask you this question about the CDC. So the CDC is advising against giving people who are not immunocompromised, so they have a strong immune system, against giving them a booster shot. Do you agree with that?
No. Even today, you saw the World Health Organization come back, and before they had said, you have to give vaccines to the whole world before you give a booster. And now they said, we realize that a booster shot is saving lives and protecting vulnerable people. So we need to give booster shots in the United States to get immunity to a level to protect from the variants. Because what we're seeing is slight decreases in immunity every month after you're vaccinated. And so the further you are out, the more of a decrease in immunity. So I think we're all going to get booster shots to really give us 4 to 10-fold increase in immunity and protect us from the Delta variant and any new ones that are coming.
It's so tough to know what to do, David, when the CDC says one thing and doctors on the other side say something else. It's confusing to us.
I agree with you. The messaging is off.
Yeah.
Well, my recommendation would be...
It's confusing to me.
Yeah.
Go to your local convenience store, make it a combo, get your shot, and pick up a bag of chips while you're there.
Okay.
All right, Dr. Agus, thank you very much.